Review for vertebral system. Two vertebral arteries go up, unite, makes one basilar artery that divide in two superior posterior cerebellar arteries. Two anterior spinal arteries arise from the two vertebral arteries and go downwards. Two posterior spinal arteries arise from the two vertebral arteries and divide as follow. Two pica, providing blood to the lower anterior part of the cerebellum. Two ica, providing blood to the lower part of the cerebellum. Two labyrinth arteries providing blood to the internal ear, and two superior cerebellum arteries providing blood to the upper part of the cerebellum. Blood supply to the brain. Heart produces 5 liters blood per minute in resting person, and about 15% of the cardiac output goes to the central nervous system. Blood goes to the central nervous system via two systems, carotid system and vertebrobasilar system. Aorta is divided in these arteries. Brachiocephalic trunk, then left carotid sinus, and then external and internal carotid artery. Left common carotid artery, then left carotid sinus, and then external and internal carotid artery. Left subclavian and then vertebral artery. Both internal carotid arteries are heading towards the brain. This is the major blood source to the brain. Left and right vertebral arteries go up and meet together and supply blood to the central nervous system. Carotid system is also called interior system. Vertebrobasilar system is also called posterior system. Transfer processes in cervical vertebra has phenomena. Through them vertebral arteries are going up, and through foramen magnum they are entering in the cranial cavity. Under the skull we have dura mater, arachnoid mater, subarachnoid space with CSF, pia mater with blood vessels, brain gray matter, and then brain white matter. Internal and vertebral arteries are floating in the CSF of subarachnoid space, making circle of Willis. Berry aneurysm rupture and hemorrhage in subarachnoid space. Vertebral arteries reaches to the medulla at pontomedullary junction and unite. Now onwards they will be called basilar artery, moving up, cross pons and third cranial nerve region, and then divide into two terminal branches going up and posteriorly, called posterior cerebral arteries, supply blood to the posterior part of the cerebral hemisphere. In front of medulla, two branches come from the both sides of vertebral arteries. They unite together and they descend in the internal median fissure of spinal cord. This branch is called interior spinal artery. Two posterior inferior cerebral arteries, pica, arise from the vertebral arteries, supply blood to medulla and cerebellum, and then move up. Pica or pica is also eating disorder where people eat non-nutritious things. Interior 2/3 of the spinal cord is supplied the blood from interior spinal artery. If this artery is blocked, the 2/3 part of the spinal cord will go into the infarction or necrosis. Segmental arteries are coming and joining the interior spinal artery to reinforce the blood. Segmental arteries, as they move inside the spinal cord, divide in interior and posterior division. Interior region is called anterior radicular artery, reinforcing the blood in the interior spinal artery. Posterior region is called posterior radicular artery, reinforcing the blood in the posterior spinal artery. There is only one interior artery, but there are two posterior arteries. Posterior arteries are coming down either from the vertebral arteries or from pica. Some of the branches of posterior arteries are neck cervical arteries, deep cervical arteries, intercostal arteries, lumbar arteries. Great medullary artery of Adam Kiewiez, Kiewiez, is the biggest artery directly coming from the aorta to replenish anterior spinal artery. In anterior spinal artery, there are at least 2 points where the blood flow is very low. First is the right before the posterior arteries branches at T4, and the second is right below the blood reinforcer arteries at L1. That means if the blood flow is less in the anterior spinal artery, the most probable place of infarction will be T4 or L1. In posterior spinal artery at T1 to T3, the blood flow is little by default. Two anterior inferior cerebellum arteries, AICA, arise from the basilar artery and supply blood to the anterior inferior part of the cerebellum. AICA also supply blood to the lateral part of the pons. Labyrinthine arteries are next, arise from the vertebral artery, go into the foramen magnum from the 7th and 8th nerve, going through internal acoustic meatus, go to the internal ear and supply the blood. After labyrinthine, there are some small pontine arteries. Then there are two superior cerebellum arteries supplying blood to some of the midbrain and upper part of the cerebellum. These arise from lower part of the third nerve or oculomotor nerve. Then two superior posterior cerebellar arteries arise from above the oculomotor nerve.